slides, you can move it here.
This arrow and that arrow.
Thank you, Lupin, for organizing this webinar. Today topic is something unconventional. I am speaking on the reversal of type 2 diabetes. We have been told from the medical school that diabetes is a chronic progressive disease, and once you're diabetic, it's a lifetime diabetes. It is not completely treatable. It can be treatable, it cannot be completely reversible. But the various studies and various people across the world are just proving that in most cases type 2 diabetes can be reversible. So what is that meaning of reversal mean? So diabetes, like type 1 diabetes, there is no actual cure because it happens because of insulin deficiency. We cannot completely reverse it. So giving insulin is the only treatment. In type 2 diabetes, there are 80% of the cases there is insulin excess in the body and insulin resistance. So there can be other causes like genetic and multifactorial causes, but 80 to 90% cases of type 2 diabetes is caused by insulin excess and insulin resistance. So when we decrease that insulin resistance, improving the insulin sensitivity, there is a lot many chances that the diabetic status can be reversible. So the reversing a diabetes in a type 2 diabetes actually means that a significant long-term improvement in the insulin sensitivity, so that the diabetic patients can lead a life with the normal blood sugars without medications, just by following a diet and lifestyle changes. So as per the research and the case studies across the world, there are effective ways to reverse diabetes are the low carb diet. Second thing is studies after bariatric surgery in a morbidly obese patient. Later the blood sugar become normal. The other options are the fasting therapy, very low calorie diets, and exercise and lifestyle changes. As per the 2010 study showed that 3 years after gastric surgery, gastric bypass surgery, a bariatric surgery, almost 72% of the diabetic people had achieved a complete remission. And 2013 study also reported that 24% participants with type 2 diabetes achieved complete remission 6 years after receiving gastric bypass surgery. Of course, the gastric bypass surgery is not the answer for all the diabetic patients, because every surgery has its own complications. So what we must learn, what we must target is reversing a type 2 diabetes without surgery, with only diet and lifestyle changes. The first key element in reversing a type 2 diabetes is a low carbohydrate diet. The various studies from the last 10-15 years have consistently proved that low carbohydrate diet is very effective in reversing type 2 diabetes. Since the type 2 diabetes is basically because of insulin resistance, so when you reduce the carbohydrate intake, so that helps in surging of blood sugars, that also helps in reducing the insulin spikes. And third most effective method in reversing type 2 diabetes is a fasting. So don't confuse the fasting with a starvation. Here the fasting is with the time specific eating. You are eating at a particular point of time and you are not eating at a particular point of time. Here there are various forms of fasting. The fasting for 16 hours and eating for 8 hours, and fasting for complete 24 hours, and next day eating all the regular 3 meals in 24 hours. So there are various fasting methods. If followed with a proper supervision, it is one of the best method to reduce the insulin resistance and thereby helps in reducing type 2 diabetes. There are a lot of research by Dr. Jason Fung, a Canadian nephrologist who has special interest in diabetes. He also wrote a book called Diabetes Code, where he's explained with studies with his own patients that the fasting can be effectively implemented to reverse type 2 diabetes. In my clinical practice, I have seen many patients, especially who are recently diagnosed diabetic patients and a pre-diabetic, who has advised them a low carb diet and a fasting, who after a period of 3 to 6 months, they could effectively reduce their HbA1cs from 8.59 to 6.5 and below. And there are many other studies to confirm that a very low calorie diet with a proper intensive exercise program also reverses the type 2 diabetes and obesity. The type 2 diabetes diet and the obesity diet almost the same, because the cause for a diabetes as well as obesity, the primary cause is insulin resistance. Of course, there are so many other causes. When you reduce the insulin resistance, automatically your diabetes also get reversed and your overweight also get reversed. And the damage caused to the various organs because of diabetes cannot be reversed just by giving the medication or insulin. For example, there are more than 7 randomized controlled trials have proved that a tight blood sugar control with the medications cannot reduce the incidence of coronary heart disease or any complications of diabetes, because as a sugar level of just more than 140 after food, the damage starts. So just treating a diabetes with just a medication and insulin is like they just lower the blood sugar level. That definitely doesn't reduce the complications and the damage does to your organs. So diabetes treatment is not just reducing your blood sugar. The treatment should include reducing your blood sugar, along with that improving the insulin sensitivity, so that over a period of time the dependency on the medication and insulin should reduce, and more or less in many cases you should live with a normal blood sugar only with a diet and lifestyle. If you just trying to reduce your blood sugar only with a medication, that matlab you are treating a fever with a paracetamol, but you are not treating the actual cause of fever. Here the giving only medication and insulin is like just treating symptoms of diabetes. We are not treating exactly the cause of diabetes. The exact cause of diabetes is insulin resistance. When we try doing that, then we are actually treating the diabetes. So to summarize so many things, I will explain you the 9 effective ways to reverse a type 2 diabetes. And these things, every doctors, every patients or people living with diabetes must know, so that they can lead a healthy life without much dependence on the diabetic medication and insulin. If you are a pre-diabetic, you can reverse your condition by following these effective ways within 3 to 6 months. And if you recently diagnosed diabetes, definitely you can reverse your condition as early with less than a year. If you're already diabetic for more than 5-10 years, definitely the insulin resistance develops over a period of time. It takes more time to reverse the condition. The first effective method is avoid refined carbohydrates. Fortunately, the interesting point to note here is, so we have seen that from 1975 onwards, the various guidelines across the world said that fat is the bad. So have a low fat diet to be healthy and to free from cardiac problems. So we have only 3 macronutrients like carbohydrates, fats and proteins. When there was a campaign against fats and when there is a campaign to reduce the fat intake, so what is the options? The only available option is carbohydrates. And in a country like India, where whole of the South India, the diet is only rice based, and the North India, the diet is based only in the wheat and all. Both are carbohydrates. And when we have an option, when we have a guidelines are telling us that should have a low fat diet, people started eating more and more grains. And if you observe it, when the guidelines started telling that you should have a low fat diet from 1970s onwards, from the 1980 onwards, with every decade there is a continuous rise of diabetic cases. From the 1980 till now, every year, every decade, there is a rise of diabetes cases exponentially. Almost in India, right, we're almost having almost 10% cases of diabetes, 10% population are diabetic. So the key component in reversing the type 2 diabetes is you should avoid refined carbohydrates. So the completely avoid sugars, completely avoid white rice, completely avoid breads, completely avoid Maida items, completely avoid sugary drinks and sugary snacks. Even the whole wheat bread should be avoided. Why is the whole wheat bread having a glycemic index more than its sugars? So it's almost the same. And people who cannot live without rice at least once a daily, they can allow to eat only a brown rice or a black rice in a very limited quantity. And avoid all the items made up of rice in the breakfast. And while using rotis, don't even use only plain rotis. Always go with a multigrain rotis. It's a mix of millets, ragi or jowar, which is more fibrous. And with respect to the fruits, have only not more than 150 grams of fruits in a day. The fruits are very sugary, and nowadays because of hybridization, what fruits we are eating is majorly made up of a carbohydrate and vitamins. And if you keep on eating more and more fruits, obviously your sugars goes high. And if you keep eating the fruits after your meal, it's like a second meal. Your sugars goes high, insulin resistance goes high. Again, the diabetes is not a healthy way for a diabetes. And be careful about starchy vegetables like potatoes, and eat them. No need to avoid them completely. Eat them in limited quantity. Second effective way to reverse type 2 diabetes is eat a moderate quantity of natural fats. Don't be in an assumption that if you start eating a fat, you will become overweight, and that's not healthy. That is completely a false notion. As I said earlier, when people started reducing the fat intake from 1980 onwards, there is a continuous rise of diabetes. Imagine our 80% brain is made up of fat, and each and every nerve of us is made up of fat. The initial breast milk of the human breast milk contains predominantly fat. Only the bad fats are processed fats like vegetable oils, like what we use, canola oil, safflower oil, sunflower oils. They are the bad fats. The good fats, like the good natural fats like avocado, olives, almonds, paneer, coconut, egg yolk, fish, fatty fish. These are the healthy fats, and these fats doesn't make you overweight, and consumption of the fat never rise your blood sugars. Carbohydrates rise your blood sugar like anything. Even sometimes the proteins also can rise your blood sugar. Fats is the least stimulant of insulin, and fats will never raise your blood sugar. Eat a healthy fat. That is one of the effective way that keeps you full, and it effectively improves the insulin sensitivity and helps in reducing the blood sugar spikes. And third important thing in reversing the diabetes is include a good quality proteins with every meal you eat. This is the thing to reduce weight and reversing the diabetes. So what is the thing? For example, if you take our South Indian diet, people say that we had some dosa, idli. If you just evaluate what is the amount of protein you are consuming with every meal, it hardly less actually. And especially the vegetarian diet, people eat I think less than 15-20% of diet. So whenever you are eating, whether it's a breakfast, lunch or a dinner, make sure that you having at least a 30% of a quality proteins with you. Having a 30% of proteins with every meal helps to boost the basal metabolism so that the calorie burning capacity will increase. And proteins with every meal will stabilize your blood sugars and decrease the craving for the food. Suppose if you have a 30-gram protein in the breakfast, For example, along with something we have 2 to 3 eggs in the breakfast or some protein shake with the breakfast, your craving for the food for the entire day will decrease. You won't get hungry, you won't eat unnecessary things in the afternoon. So whether it's a lunch, dinner or a breakfast, make sure that your meal should contain 30% of the proteins. And fourth important thing is fasting. See, fasting is something one of the ancient techniques which is having history of some 4,000 years and which is followed in almost all the religions, whether it's a Hinduism, Islam, Christianity, Jews, whichever religion you take, there is a method called fasting and which is time tested. Fasting in the sense, I'm not telling to starve. Fasting is not starvation. Fasting is like have adequate liquids and have some low calorie fluids like green tea or a coffee or tea without sugars, and in some particular point of the time you should not eat, and in some particular point of the time you should eat. For example, for a woman the best type of intermittent fasting is 15 hours fasting, and for a man it's a 16 hours fasting. The best example is make your eating time between suppose 9 to 5 and make your fasting time between 5 to 8 or 5 to 9, so that after sunset if you reduce your calories, one thing is for millions of years, for almost more than 8 million years, people never ate after sunset. Electricity came only 125 years ago, and before there is no option for cooking in the night, so people were not eating in the night. So if you start eating after sunset, you start eating after in the late nights and all, actually we are going against the evolution of our human body. So that whatever you eat, it becomes a toxins, or while sleeping in the night, why we need a 600 calorie dinner? So calorie requirement is not there in the night, and not having a day, not having anything after sunset also give a rest to your GAT. So based on this historical background, the main advantage how the fasting helps in type 2 diabetes is the fasting after 6 hours of fasting, whatever the glucose stored in the liver comes get used it, and after 10 hours of fasting, 10 to 12 hours of fasting, the fat start burning. So when there is no intake of food at all, so there is no insulin rise of blood sugars, there is no need for the pancreas to secrete insulin, so automatically the insulin sensitivity will improve. So once the insulin sensitivity start improving, there is a scope to reduce your insulin resistance, and once the insulin resistance comes down, there is a hope and scope for the reversal of type 2 diabetes as well as obesity. So in this way, the fasting is one of the very effective method to reverse type 2 diabetes. But only thing is, it is very easy for the young, recently diagnosed diabetic people or a pre-diabetic. People who are already on medications, already on insulins, do a proper fasting only under supervision. And across the world, the Jason Fung, a Canadian diabetologist and a nephrologist, who followed an intensive fasting method for his patients, and he has many case studies that the fasting for a 24 hours twice or thrice a week, or a 16 hours fasting 4 to 5 days a week, many people have reduced the weight as well as diabetes. And many of my patients, I have advised them for the intermittent fasting or a 24 hours fasting once a week, and many of them have reduced the HbA1c to less than 6.5, and many of them are living a life without taking medications, and many of them have reduced a weight also. So I explained about low carb diet, I explained about good fat diet, I explained about a protein diet, I explained about I explained about the fasting. Then there is one more interesting thing that if our gut bacteria is healthy, you are healthy. Most of our health, immunity depends on the health of our gut bacteria. So many studies showed that there is a link between the state of our gut bacteria and type 2 diabetes. If we improve the health of our gut bacteria, automatically that helps indirectly in keeping your blood sugars under control. So keep your gut bacteria healthy by eating a good probiotic foods and multicolored vegetables and a yogurt, and if not, by taking some probiotic supplements. And the most essential for the maintaining a good blood sugar is the maintaining the ideal body weight is the first step in prevention and reversal of type 2 diabetes. Of course, in all the cases, in almost few cases, people are lean, not obese, even then they get type 2 diabetes. But many of them may not have the fat outside. Many of them have a visceral fat. They have a fat deposition inside the abdomen, around the liver, around the pancreas. That visceral fat is contributing to insulin resistance, thereby they're getting diabetes. So the rough estimate to measure your visceral fat is the waist measurements. If you may look thin, but if your waist circumference is more, and if you have little fat over the abdomen, then definitely you have a more visceral fat that might be contributing to your insulin resistance. Your overall you may look thin, but if your visceral fat is more, definitely that is contributing to your diabetic status. So the most important thing is maintain ideal body weight, maintain the ideal waist hip ratio. That is very critical in reversing the diabetes. And the seventh important method is exercise and yoga. Of course, this is not just the ancient history. The yoga exercise in the modern last 15-20 years, there are many research studies, there are many case studies which has proved that consistently following yoga and exercise at least 3 to 4 days a week is very vital in reversing the diabetes. And eighth important point is managing the stress levels. What happens if somebody is also on a chronic stress? When the chronic stress is there, your cortisol hormones will go high in the blood, and the cortisol hormones increase the blood sugar levels, and to reduce the blood sugar levels, your insulin spikes up, and insulin spikes up, again insulin resistance will increase, and thereby get diabetes. So chronic stress is definitely one of the cause of diabetes, and to effective control of diabetes is not possible without reducing your stress levels. So manage your stress levels by regularly practicing a pranayama and meditation, which is time tested, doesn't need explanation. And a ninth effective method is, many studies have confirmed that somebody is very morbidly obese, like the BMI is more than 40 and nothing is working out, for them the diabetes can be reversible by a bariatric surgery. But this is not an option for everyone. Even with a bariatric surgery also, you have to have a calorie restriction. So these are the 9 effective methods wherein your diabetes can be effectively reduced. So to conclude, the reversal of type 2 diabetes can be achieved fast in a pre-diabetics and in those recently diagnosed diabetics. Of course, if you are diabetic for a long time, 10-15 years, 10 years and all, it takes long time to reverse a type 2 diabetes. And if you have some component of diabetes, like 5-10% cases, it could be influenced multifactorial genetic also. In such cases, complete reversal is not possible, but definitely your dependency on the medication and insulin will decrease. The dose of your diabetic medication and insulin will decrease. And recent studies across the world and many case studies across the world recent shows that there is a hope for that. Many diabetes is not a completely chronic progressive disease, and most cases of diabetes can be reversible. Thank you, and I thank Lupin for giving an opportunity to share my ideas about reversing the diabetes status to my colleague doctors and as well as the public.